I'm Lucy Beednell with the ARC of Northern Virginia. This 3-minute webinar focuses on the Virginia Health Insurance Premium Program, commonly called HIPP. HIPP is a program that offers assistance with the monthly premiums you pay to stay enrolled in an insurance plan if someone on that plan also has full coverage Medicaid. Depending upon the situation, the HIPP program can pay all or part of that monthly premium for the person with a disability to be enrolled. There's a separate program for kids called HIPP for Kids that's available to people who have Medicaid as well as an insurance-sponsored plan, employer-sponsored insurance plan, and are under age 19. HIPP for Adults is simply called HIPP. HIPP not only offers financial help with the monthly premiums, but HIPP for Kids can offer assistance with co-payments and deductibles in some cases. Also, anyone who is enrolled in the HIPP program will not be rolled into CCC Plus, Medicaid's managed care program. Let's take a look at the difference between HIPP for Adults and HIPP for Kids. HIPP for Adults can pay all or part of someone's monthly premium. The calculation there is made by Medicaid based upon the amount of money the person is usually incurring per month for medical care and expenses versus the cost to keep them enrolled in an employer plan. If to Medicaid it looks like it would be a cost savings to keep them enrolled in an employer plan, so Medicaid's not the only person covering those medical expenses, they'll pay all of the premium. For anything less than that, they start looking at a cost-sharing balance. This can be offered to people who have insurance because they're adults with disabilities who have their own employer-sponsored plans, or adults with disabilities who continue to be on their parents' employer-sponsored plan. The cost-effective rule applies to that calculation we talked about. Is it cheaper for Medicaid to enroll you in HIPP and pay your premium, or cheaper for Medicaid to pay your average medical expenses? High deductible plans are not eligible, and family plans where 3 or more family members who are not eligible for Medicaid or on the plan cannot be enrolled. So for example, if there's a 4-person family and one person on that plan is an adult with Medicaid, and it's the parents' owned plan, that family would not be eligible since 3 other family members who are not enrolled in Medicaid are on the plan. HIPP for Kids, on the other hand, always pays the entire monthly premium when someone is eligible. It can cover some expenses like co-payments for doctor's visits, deductibles, and other costs that are not fully covered by the primary insurance, so long as the service is one also offered by Medicaid and the service was provided by a doctor who either accepts Medicaid or the employer-sponsored plan. Plans to be enrolled must be comprehensive. The employer must pay at least 40% of the total cost of the monthly premium, and high deductible and non-medical plans are not included. To apply for HIPP, you can look at more information online at the state's HIPP website, email HIPP staff, or call this number. Your employer will need to fill out paperwork and submit it for the initial application and on an ongoing basis to show that the plan continues to be eligible. Please visit us online at thearcofnova.org. Ask us questions 24/7 at thearcofnova.org/answers and get an auto reply and follow-up from staff. And check out our Transition Points toolkits with tons of free resources across the lifespan.